Hi there. Welcome back to DBT for people with FND. And we are moving on from understanding and naming emotions to actually trying to use skills to change our emotional responses. And so this is going to involve three different skills that we'll be covering in the next few weeks. And really, the point is to change unwanted emotions. We must first do a few things. The first is to check the facts, because sometimes this is all that's needed. When the emotion doesn't fit the facts, we just need to practice acting the opposite of our emotions. And when the emotions fit the facts, sometimes that just indicates a problem that needs to be solved. And so the checking the facts is what we're going to be focusing on today. And it really is changing your beliefs and assumptions about a situation, much like we talked about your interpretation in that model of emotions, to fit the facts to help your emotions and reactions. And this requires that you first check out facts. Checking facts is really a basic strategy in cognitive therapy, as well as many other forms of therapy. And when the emotions don't fit the facts, and knowing these facts doesn't really change your emotion, then we'll be talking about opposite action next week and doing this repeatedly all the way over and over until you feel differently. And we'll go into a lot of detail about that. And I'm sure you may have had experiences with that already, where you might be afraid of something. And if you do it repeatedly, you become not afraid. And then problem solving is when your emotions fit the facts of the situation and you want to not feel those emotions. It really, your emotions are indicating there's a problem to be solved. And so knowing how to solve problems is super important for decreasing the frequency of negative emotions or unwanted emotions. And doing, there is this yes, but barrier to changing emotions. Doing what's needed to change emotional responses can be really difficult, and it requires effort, willingness, and ability to determine one's own best interest. And that sometimes can be challenging. And so we'll talk in more detail about that. But sometimes when you're needing to solve a problem, you can either change the situation by leaving the situation. You can change your emotional reactions to the situation. That's painful emotions are reduced even though the problem remains. Or you can radically accept the situation and acknowledge the situation can't be helped and that you can't change how you feel either, but that completely and willingly accepting the state of affairs can also give you some sense of freedom and reduce your suffering. Or the fourth is to do nothing, stay kind of willful and miserable, and the status quo. So that's we'll be talking more about the options when you face a problem. So the first main point I want to talk about for the checking the facts um, are the actual steps involved. And, we really react to our thoughts and interpretations of an event rather than the facts of the event. And so changing our beliefs and assumptions to fit the facts can really help change emotions a lot of time. So, why should you do this though? Um, well, thoughts and interpretations of situations and events instead of facts can set off really painful emotions. So, beliefs about reality can cause powerful emotions. And we learned about that in the model of emotions. And how our interpretations can really make emotions very strong and painful. Faulty beliefs about what we think we need can lead to emotional misery. Faulty beliefs about events can cause new problems if we don't have the facts. Perhaps, you think I can pass a test without studying for it beforehand. And when you get a low grade, for example, you need to have the facts so that you can actually know that you needed to study more, not that you're innately unable to learn something. And thinking it in absolute terms can really set off emotions. So if you have kind of rigid thinking, thinking in absolutes, black and whites, inflexible thinking, that can lead to a lot of emotion turbulence, let's say. So learning how to be flexible in interpreting or having hypotheses or generating ideas about how a situation might be different than one is assuming can be quite important. And there is some data that people with FND have sometimes less flexibility in general as a whole compared to the population as a whole, and that they generate less hypotheses when faced with circumstances um, than uh, than a typical person. And so what that means is when one person might generate a lot of hypotheses about why something is happening. There might be 10 options. And a person with FND might just generate two or three. And so if you're not thinking about all the possibilities, you're more likely to be wrong or not be able to think of something outside the box that you may not know or may not be able to predict. Um, so just think about have there been interpretations in your life or thoughts that have influenced how and what emotions you've felt. Our emotions can really affect what we think about events and how we react to thoughts. So temporary moods can influence ideas, memories, perceptions, interpretations of events, particularly when the events are complex and ambiguous. And the very same information can take on very different coloring depending on our current emotional state. So, believing that our thoughts are absolute truths can be a recipe for disaster. So it's important to keep these things in mind that no one has the absolute truth, that believing that I have a hold on absolute truth ordinarily leads to conflict and can precipitate even violence and wars. Different opinions on the facts can be valid, even if we don't agree with them. There's always more than one way to see a situation and more than one way to solve a problem. And two things that seem like or are opposites can both be true, and meaning and truth evolve over time. So, knowing the facts is essential for problem solving too. So, incomplete knowledge about facts or faulty beliefs about them can really interfere with problem solving. Examining our thoughts and checking the facts can change our emotions. So, when we respond to incorrect facts and learning correct facts, they really can change the way we feel. An additional knowing of the facts of the situation can really help us problem solve emotional situations. And knowing the facts can help us change the facts and give us some influence and autonomy over a situation that we may not have had otherwise. And I do want to come back to maybe examples and ways that this might show up in FND. So people with FND often have unhelpful beliefs about their symptoms or even their illness. And checking the facts can be really effective. For people with FND, might be we know that people with FND do a lot better with psychoeducation than without psychoeducation. I know I've had clients who thought that their FND was not reversible, that it was only going to get worse, that there were no treatments for it. There's also people can think that they can never return to do something that they love, when in fact maybe they can. So there can be a lot of unhelpful beliefs and assumptions about the FND and how it's influenced their life. And so that is why we think too that psychoeducation for people with FND actually helps prognosis so much, and the research shows that. And furthermore, I think, as I said before, there are cognitive studies of people with FND that show that they jump to conclusions very quickly, which can be an asset in a lot of ways. When you need to think fast, act fast, that's great. But again, like any strength, it can be a weakness. So it can be that kind of pattern can be really harmful when forming medical hypotheses based on somatic sensations. If an example, if somebody's having some stomach pain and they limit their prediction to, oh, it must be stomach cancer, or I'm have an ulcer. They may assume that discussing the pain with their doctor will just lead to invalidation. Um, that might be another prediction. And such predictions can lead to excessive either healthcare utilization, or if they're thinking that they're going to be invalidated, could be avoidance of medical care. So it's crucial to check the facts and think about multiple hypotheses, especially around FND. So you're not doing something ineffective like not going to the doctor when you need to, or not going to the doctor too frequently, and putting yourself at risk for that. And also to just decrease the amount of anxiety or fear or emotions and frustration one might have around their symptoms. Um, and also, these unhelpful thoughts are sometimes formed from previous experiences with FND or other illnesses, or seeing a loved one experience an injury or an illness. And once unhelpful thoughts are formed, it can be really hard for us to incorporate this new evidence into pre-existing beliefs. And then it's important to also check the facts about whether one is actually able, or feeling too sick or too tired um, um, to actually do what's needed. So sometimes observing one's limits and knowing whether you can or cannot do something requires checking the facts. So, for example, if you think, like I might have a seizure if I go to the grocery store, so I can't go to the grocery store. Well, maybe you can check out the facts and do it for 3 minutes and see if there's any risk of doing this. And so sometimes checking facts can lead one to be able to um, have less limits in your life and let go of avoidance behaviors that we know can make an FND situation even worse. And so those were, I think, just examples that are often seen in my practice with FND. So let's move on then to actually, how do you check the facts? And I'd like to go through each one of these things. So first, you want to ask, you know, is what is the emotion that I actually want to change? It much it it is much more difficult to change an emotion when you don't know what the emotion or set of emotions are that you're actually feeling. So, and especially because FND, um, um, people with FND and other populations and behavioral and mental health often have trouble identifying feelings. It might be difficult to know how you're feeling. It could be that I'm stressed, but what stress could mean a lot of things. Is that anger? Is that frustration? Is that fear? Um, is that jealousy? Is that sadness? Knowing what emotion that you want to change can be critical, and paying attention to your current thoughts, physical sensations, posture, action, urges, going back to that model of emotions and reviewing that. And then ask yourself, what is the prompt? What's prompting the emotion? Describe the facts observed through the senses, just the facts, using your mindfulness skills. You want to challenge any judgments, extremes, black and white description, and come up with a more balanced view of the facts and change that might change your emotions. And prompting events can be events outside of ourselves, but they also can be internal events, such as a previous emotion or some FND sensations or behaviors. Um, they can be a series of thoughts or ability or inability to do a task. It could be dissociative or cognitive symptoms one's having. A prompting event can be a secondary reaction to a previous emotion, like anger at ourselves or for being afraid, or a thought feeling guilty at being at a judgmental thought one is having, or a lack of ability. Um, and um, knowing the facts is really um, essential. And one problem in figuring out emotions is that we often describe situations and our own emotions, thoughts, and actions in a judgmental language with absolute black and whites. And usually, this is not an effective way to describe an event because it can evoke a lot of negative emotions. So you really got to practice that mindfulness describe skill and using the how skills of being non-judgmental. And what are your interpretations, thoughts, and assumptions about the event? So look at that. Often we add to what we observe and then react to that. Think about some erroneous interpretations you might make when you're feeling a particular emotion. Um, Often, if we're angry, we're listening to a person expressing disappointment in something that you've done or you do, and thinking the person is trying to control you would be like an interpretation. So the fact might be they're disappointed, and then your thought might be that their interpretation, that's not a fact, is they're trying to control you. Um, or if for fear would be like, hearing a creaking sound at night, that's a fact, the sound. But thinking someone's breaking into your house, that's an interpretation because you don't know. That's a prediction, or you're looking for a cause for something. Um, so consider all the possible interpretations when you're thinking about and identifying the prompter. Other reasonable interpretations, particularly if they're more benign, can be effective way to regulate your emotions. Giving people the benefit of the doubt, practice looking at all sides of the situation, all various points of view, and then ask yourself, well, what is the threat? That's the next part of this. What am I assuming? Ask yourself whether you are imagining a threatening event or an outcome. Painful emotions are almost always related to some type of threat, like a catastrophe or something that we're trying to avoid. The negative outcome might be anticipating might be that anticipation of that event. And so often we, are not even aware that we're assuming some sort of threat. And uh, the threat is sometimes implicit in our mind. That means without awareness. And it can be important to really search for the threat that we're associating with the prompting event. And this can be particularly important when we're checking all the facts and still are having intense emotions. This is a clue that our current emotions may be a secondary emotion, that it may be very important to figure out what that threat is that we're reacting to. So label the threat. So you want to the first thing is to label it, and which involves labeling the emotions. And you have that apothecary of emotions in the prior session that can maybe help you label some of the prompters and particular threats. So anger might be a threat of being attacked or important goal is blocked. Guilt might be violating your own values. Shame might be being kicked out of a community. And then after you've identified that, you can evaluate the chances that that threatening event will really occur. And it's important to be in wise mind when you're considering the likelihood that a threatening event will occur. So often what seems threatening at first glance is not so threatening once we think about it or some time has passed. Um, so consider what the outcome in the previous, what was the outcome the previous times that you had a similar thought, like if you were um, going to a party with family and you're worried that you're maybe going to have, you're having a lot of fear that you might have some symptoms. You could imagine, well, what is it that I'm really afraid of? That maybe that they would see that you have an illness, or is it that you would not be believed, or people would treat you differently, and judge you, or that you would be rejected in some way. I think that's quite important to figure out what is the catastrophe, even though it might be a remote chance of it happening, even if you have infrequent symptoms. You might still be worried about that catastrophe happening and the worst case scenario. So see if you can think about see if you can think about a more realistic possible outcomes. So think of other possible outcomes. Imagine as many possible outcomes as you can. And the simple act of generating alternative outcomes itself can increase your belief that other outcomes are possible. And really, I love to have people really concentrate on that catastrophe, the worst case, instead of trying to avoid the catastrophe. Let's say you have a symptom at a party, and then all your relatives decide that you're an ill person and they're not going to trust you, and they're not going to invite you to any more parties, and you'll lose respect. Well, if you know, really think about that outcome, what it would mean, even though it's probably unlikely. Just think about it anyway. Kind of bringing the worst case to your imagination and what it would be the realistic consequence. Sometimes the facts are every bit as bad as we think, though. Sometimes the catastrophes are very common. However, we often can make a bad situation even worse when we catastrophize the facts. So, catastrophizing is exaggerating the negative characteristics of the facts and focusing on the worst part of the possible outcome. Panic induced by the thought of, oh my God, I'm dying, can constrict the blood vessels and actually increase the probability of having a panic attack. And catastrophizing can increase both physical pain and emotional pain. So I think it's important to think about your catastrophe and imagining actually coping with it well. And imagine yourself in the worst possible situation. Ask yourself, how likely is that to happen? And then think about yourself problem solving, coping ahead, radically accepting. And then lastly, does you want to ask yourself, well, does the emotion and the intensity fit the facts? Like maybe it is scary to go to a party with your family and not know if you're going to have an FND flare, let's say. But is the intensity of your fear, does that really fit the facts? Um, um, because the emotions that you're trying to change might actually fit the facts of the situation, but the intensity of the emotion may not fit the facts. So you could be a little bit nervous about it, but if it's an unlikely scenario, and you know that it would likely you would get good responses. You know that then you would actually be able to um, be able to cope with the situation. All right. Now, the next part of the handout are examples of emotions that fit the facts. So, going back to the function of emotions, if you're trying to decide whether something fits the facts or not, this is a good handout to go over. Fear when there's a threat to your life or someone you care about, and there's a threat to your well-being or someone you care about. Uh, Anger uh, would be important goals being blocked. Discuss something that you're in contact with poison or contaminate you. Envy, another person group gets or has things that you don't have and you want and need. Jealousy, very important or desired relationship or object in your life is in danger of being damaged or lost. Someone is threatening to take a valued relationship or object from you. And love would be loving a person, animal, or object that enhances your quality of life for you or those that you care about. Sadness might be someone you've lost something or someone permanently, or things are not the way you wanted or expected them to be. And shame would be when you're rejected by a person or a group that you care about. If characteristics of yourself or your behavior were made public. And guilt is when your own behavior violates your own values or moral code. And then also the intensity and duration of the emotions are justified when one, how likely it is that the expected outcome will occur. That two, how great and or important the outcomes are. And three, how effective the emotions are in your life right now. So for homework, we'd like you to work on worksheet 5, checking the facts. You can, again, ask what your emotion's doing for you, what prompted the emotion, check the facts. What are the interpretations? Then ask you to check the facts again. It's really important when you do check the facts, you want to do it multiple times. Rewrite the facts if necessary, do it over and over again. I know oftentimes I'll get an email and I'll have an emotional reaction and I'll read the email again, or I'll read the email to somebody else to make sure that I've got the facts, that I'm not adding interpretations. I might write down what they said. Um, and then step 4 is what is the threat? What are you worried about? What's the event or situation that's threatening to you, and the consequences and the outcomes that you're experiencing, and then check the facts, as many possible other outcomes, and give the facts, and then rewrite that. Um, and then also looking at what's the catastrophe. And if the worst case happened, how would you reasonably cope with it and deal with it? Um, and then also, step 6 is, does your intensity fit the facts? And you can put that on a scale from 0 to 5, with the 0 being doesn't at all fit the facts, and 5 is I'm certain it fits the facts. And describe how do you check the facts about your intensity of the effect, of the emotion, fitting the facts. And so then next week we will do opposite action and problem solving. All right, good luck with checking the facts.